The Bridge Clinic gives me hope to stay strong. With love and respect, thank you. I'm a super emotional badass.
Historically, we really always thought substance use disorder was related to intention, to will, to bad behavior, and when you wanted to change, you would change. There's an utter failure in all of that to understand that it is a brain that's been deeply affected and can't really make decisions or is really affected by the decisions.
So in 2013, we set about writing the plan for the Substance Use Disorder Initiative, and the vision was to bring effective addiction treatment based on all the research that's been out there into the medical settings where patients are showing up. This sort of historic approach to addiction treatment is what I would call sort of high threshold and low tolerance. It's really hard to get in the door. We make it impossible for people to access care, and then we blame them when they don't get the services that they need or they don't get better. A lot of times we'd hear things like, oh, that person failed treatment, or they failed, counseling or something like that. And really flipping that on its head to say, people don't fail treatment, treatment fails a person. So if this person is not getting better, it's on us to think about what are we doing wrong, not to blame the human being.
It's amazing the stories I get from patients when I talk to them about, when did you first start using substance? And then trying to understand was there trauma involved. There have been a number of studies that show the number of adverse experience you have as a child dictates how many problems you might have growing forward as an adult. And most of those adverse childhood experiences are linked with substance use, mental health, behavioral health.
I think the fascinating thing about the field of addiction medicine is the way it sits at this nexus or this intersection of lots of different areas. So you have elements of medical care and medical treatment that are incredibly interesting, both intellectually and on the clinical level. But then you have the broader issues of the way that we create policy in this country, the way that we police communities, the way that racism has impacted our society on so many levels, issues of discrimination and injustice. And you also have this tremendous sort of resiliency and the survival of the people that we're serving.
Under the umbrella of the Substance Use Disorders Initiative, we have services across the entire system, including the inpatient addiction consult team, the emergency room at Mass General Hospital. We have services in almost all of our primary care practices. We have a low threshold clinic called the Bridge Clinic. We have the Hope Clinic, which is a clinic for pregnant and parenting women. We have a strong fellowship, a strong training program, and we have a strong research program. The West End Clinic is our dual diagnosis program, offering a range of mental health and substance use services for adults. And we also have the Addiction Recovery Management Service, providing a dual diagnosis program for adolescents and offering family support services.
We set out to build teams of addiction-trained professionals and sort of incorporate them into those different settings. And everything we did from the start was very much a team-based sort of interdepartmental, interprofessional effort. So we had expert nurses, we had medicine doctors who are trained in addiction, we had psychiatrists who are trained in addiction, social workers, and then importantly, we really wanted to involve people with lived experience as a part of the model. And so from the very beginning, we had peers who we call recovery coaches, but they're people who themselves are in long-term recovery from substance use disorder.
Mass General has been one of the oldest clinical models, and so they have really set the groundwork for recovery coaches working in clinical settings.
I was that person that needed help, and there wasn't anybody in my role to help me when I needed the help.
We knew when we started the initiative, we made a strong commitment to reach into the communities that surround our hospital and our programs in order to be able to help people link to programs and services that they might need in those communities.
The Community Care and Reach Van is a partnership between Mass General, Boston Healthcare for the Homeless, and then AHOPE, which is a harm reduction program run by the Boston Public Health Commission. So I have a pretty long-standing interest in kind of street medicine, outreach medicine, and really physically, literally meeting people where they're at and trying to provide the best care that we can there.
We have made a very intentional effort to outreach to treatment programs, to legal services, to food and housing services, different types of supports along the way so that people can get what they need in order to actually create this integrated recovery.
I wish every hospital had what we have and do what we do. We love what we do, and we love the population, most of all, the population that we work with.
There's really no other area of medicine that I get to see on a daily basis where you truly feel like you are a part of and partnering with someone and watching their life be saved. My hope for the future is that any person with substance use disorder who walks into a healthcare setting is treated with dignity and respect, they're welcomed into care, and they have access to the best medical treatment we have to offer for all of their healthcare needs.